Patient engagement is increasingly recognized as a cornerstone for more effective and patient-centered healthcare. This is especially true in the field of rare disorders, where patients, families, caregivers can actually bring to the table essential insights on more effective care pathways. In rare conditions, patients usually undergo long and complex medical journeys, and their experiences can actually bring knowledge and support patient advocacy. My name is Davide, and I live with Ollier disease, an ultra-rare skeletal disorder which affects bone development and often requires numerous surgical interventions during growth. From an early age, I experienced what it means to live with a condition that very few people, even within healthcare, are familiar with. There were moments of uncertainty, of feeling unheard, and having to explain my own diagnosis over and over again, even to clinicians. Over time, this personal experience became actually a driving force in my professional life. Today, I work as a bioinformatician at the Department of Rare Skeletal Disorders at the Rizzoli Orthopedic Institute in Bologna, Italy. Being part of such environment allows me to really contribute on improving the knowledge on these kind of disorders and also improving the care pathways for these patients just like me. One of the first and perhaps the most meaningful part of this journey have been the project that we did in collaboration with ACAR, Associazione Conto alla Rovescia, which is the Italian Patients Association for Multiple Osteochondromas, Ollier disease and Maffucci syndrome. In 2023, during the annual meeting of ACAR, we carried out a very important project, a participatory workshop based on the open dialogue approach. Different stakeholders, so patients, families, caregivers, healthcare professionals, and so on, divided into small groups discussing the same topic. In our case, the focus was on the transition from the pediatric to the adult healthcare, which is a very delicate and, I would say, fragmented phase, especially for rare patients. Together we identified main priorities during the transition: having psychological support, a better communication with clinicians, as well as a more continuous care during the transition. And these were not just abstract ideas, they were the living concerns of real people dealing with rare disorders every day. I'm quite sure that projects like that, as well as my own story, reinforce an idea. Patients are not just passive recipients of care. They can actually bring their own experiences, their needs and insights, and actually shape a better healthcare. During these open dialogues, I vividly remember I noticed two healthcare professionals animatedly discussing about this topic, about the transition from pediatric to adult healthcare, like it was the most important thing in the world. And it was in that moment that I realized, both as a patient and as a researcher, that we were going, and we are still going, in the right direction.